How do our eyes change as we age?
First and foremost, that affects 100% is difficulty reading. Need for bifocals, need for multifocals, need for a second pair of glasses. That's just a normal aging change, but it's something that will hit every single person, which means that over 90% of patients over age 50 have some need for spectacle correction or contact lenses or something.
How do cataracts develop, and are they treatable?
As the cataract starts to develop, it starts to turn yellow, which is interesting because if you look at a newborn baby, their lens inside their eye is so crystal clear and it's almost impossible to see. About age 50 and 60, it's almost as yellow as a Post-it note. And if untreated at age 80, it's about as brown as wood. Cataracts are treatable. Treatable better today than any other time before. In fact, it's one of the easiest conditions to treat in aging. Surgical correction with an implantable intraocular lens is restoring patients' vision on a daily basis.
What are the symptoms of macular degeneration?
It affects vision seriously. The best way I could describe it is if you're sitting down, you're looking straight ahead, take your fist, put it right in front of one eye, close the other eye, and that's what you see with macular degeneration. Wherever you look, that's where you can't see.
Can macular degeneration be cured?
The best news is in the past several years, 5 years for example, there have been some treatments via injection which have almost eliminated the wet form of this disease. We see it less frequently in the last several years than we have seriously over the last decade or two, which is fantastic. Meaning that the majority of patients today are dealing with the dry form of the disease, which is much less disruptive of vision. It'll still have an effect, but not drastically like it does in the wet form.
What is glaucoma?
Glaucoma is also one of the leading causes of blindness in the United States, and it is the #1 cause of blindness in our African American population in the United States. Glaucoma is historically known as a disease of high eye pressure in the eye. It's a disease where the optic nerve that allows us to see is affected adversely by this higher eye pressure, and over the course of time, slowly that nerve becomes eaten away and our vision becomes eaten away. Glaucoma is a troublesome disease. It's troublesome because it's highly treatable, very, very successful in a large percentage of patients. The problem is until very late in the disease course, it's asymptomatic.
How can we protect our vision?
Routinely, go to the doctor, get your eyes checked as an example. Just make sure you leave with some good news. You don't have X, Y, and Z. If on the flip side you get some bad news, at least feel rest assured that the quicker we can treat, in almost all cases, the better you will be.
What does the future hold?
Technology is our friend, even for patients who have suffered some vision loss. There are tremendous amounts of technology to help patients deal with the vision they have remaining. In terms of medications, powerful change. From topical medications to injectable medications to surgeries with robotic surgeries, laser surgeries. The future is incredibly exciting. It doesn't necessarily mean we're going to find a cure for everything, but it means that the treatments will be much more tolerable, safer, easier to withstand, faster acting, and that's with all the diseases we've talked about so far.
If you'd like more information about your vision, go to the website of the National Eye Institute.